Feet. You don't think about them much, but those with diabetes need to think about them every day and take steps to keep their feet healthy. That's something Ralph Guirini knows all too well.
Actually started about 2 or 3 years ago, and it was blistering that was on the surface being caused just by typical, jogging or running or whatever, and it turned out that wasn't the cause of the blisters.
Ralph was unaware he had dislocated a bone in his foot, opening the door to an infection of that bone. After months of misdiagnosis, he found his way to Beth Israel Deaconess Medical Center, partner of the world-renowned Joslin Diabetes Center. His infection had spread so widely, he was ordered into surgery the next day.
I was totally shocked. I had my foot in a cast for 6 months. And I don't get that at all, but all kinds of things had been used as therapeutics to try to get this squared away, and it just didn't. And I finally came in here, and literally within a few days I was on my way to recovery.
Feel a vibration here?
Like thousands of diabetic patients, Ralph suffers from neuropathy, nerve damage that causes either pain in the feet or, in Ralph's case, a loss of feeling or numbness.
They can step on a foreign object, not realize that they've stepped on it, and not until the foot is red and swollen and in trouble. Other patients may notice that they have a blister, but because it's not painful and they have no other signs or symptoms of a problem, don't realize that how severe it might be. So very often, the first indication that they are in trouble is when they come into the office or see their doctor, and you ask them, well, how long has this sore been here? And it's not unusual for them to say, what's sore?
Because diabetes also affects the blood supply to the foot, it makes cuts and sores harder to heal. They can quickly become infected, and sometimes that infection can spread, leading to, in severe cases, amputation. Dr. John Guirini says he is seeing more complex cases of foot injury, probably because the number of people with type 2 diabetes has risen so dramatically. He says while neuropathy is not reversible, you can take steps to manage it.
It usually starts in the toes and then works its way beyond that. So if you can prevent it or stop it at that level, you can avoid a lot of the other significant complications of diabetes.
That also means exercising, taking medications regularly, eating right, and monitoring your sugar levels. Other tips: if you have trouble inspecting your own feet, ask a family member to do it. If you do see anything unusual, bandage it and call your physician. Also, those at high risk, people with diabetes who have abnormal sensation, circulation in the feet, or those whose feet are not shaped normally, should see a foot care specialist every 3 months.
A lot of these problems are preventable, again, by inspection and regular care.
It took Ralph about 3 months after the surgery to get back to his normal routine, and now he advises everyone with diabetes to keep an extra close eye on their feet.
And if you start seeing, problems in your extremities, you got to take care of them right away. I can jog, I can walk, I can do anything I want to do.